Well, welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's top news. Pune doctors extract watermelon-sized tumor from 90-year-old's abdomen. A 90-year-old resident of Chakan with a history of 6 months of abdominal pain had a successful operation at PCMC-run Yashwantrao Chavan Memorial Hospital to remove a cancerous tumor weighing 6.5 kg, approximately the size of a watermelon. The extensive 5-hour surgery took place on 10th of October with the patient spending 1 day in the ICU. The patient had previously sought treatment at several hospitals and tried various remedies without success. Due to the high cost of treatment at private hospitals, the patient and family opted to approach YCMH. After admission on 4th of October and a series of medical tests and scans, the patient was diagnosed with a large cancerous tumor in his abdomen that was affecting the function of his right kidney. To talk about this surgery in detail, we have on board with us today Dr. Santosh Thorat. Welcome to Medical Dialogues, Doctor. So, Doctor, can you tell about the case history?
So this was a patient of a 90 years old male patient came to us with the chief complaints of pain in the aching pain in the upper abdomen, predominantly located to the right side, and the patient was suffering from the similar pain from last 6 months. When we examined the patient, we found a large mass occupying his almost half of the abdomen, predominantly on the right, and he was having intermittent history of constipation and diarrhea also. So we go ahead with the investigations, and primarily we did an ultrasonography, which was suggestive of a tumor into the retroperitoneum of the patient, that is the backside of the abdomen behind the kidneys. So for the further delineation of these facts, we went ahead with doing an CECT abdomen, which is a contrast study, which showed a mass of 14 by 26 by 35 centimeter, which was present predominantly occupying the right side of the abdomen, and it was extending from the subhepatic, that is below the liver, till the upper border of the pelvis. And this mass was found to be displacing the large bowels towards the left side, as well as compressing over the right kidneys.
Right. So, what were the complications you faced during this whole procedure?
Because of the size of the mass that is occupying almost half of the abdomen, and the whole bowel, which was there normally in the right side, has totally been shifted to the left. So the challenges were to the keeping the blood supply intact to the bowel, and second one is to release the kidney from the mass and preserve the function of the kidney. So we have to do an extended maneuver where we have freed the whole of the large bowel from the right side to the left side, and at the same time we preserve the vital structures going into the kidney in the form of right renal vein, right renal artery, and the ureters. These were the challenging things, because we have to maintain the blood supply to the bowel as well, while taking care that no tissue of the tumor should be left behind. Predominant artery for the upper abdomen is the superior mesenteric artery, which needs to be saved at any cost while doing these kind of surgeries. So we have to be very cautious while we are freeing all the large bowels from the whole of the area of the tumor, and at the same time we are taking care not to leave behind any tumor tissue.
Okay, and what about the prognosis? How is the patient now?
Actually, the patient, though 8 years old, we did a good pre-operative management of the patient. We started the patient on the total parenteral nutrition, even started with multiple multivitamins and antioxidants before starting the surgery. We did his other investigations in the form of his CT scan of the chest, which showed us about present condition, because being 90 years is old age, and here doing such major surgeries, we need to be very cautious dealing with his post-operative outcomes. So currently at present the patient is out of all the dangers. Now it's post-operative day 10 and is being ready to get discharged from the ward. He's taking normal diet, moving around. He doesn't have any complication as of now. We kept the patient for a period of 1 day in ICU just for keeping monitoring of his vitals, as his old age was demanding these kind of care. That we also underwent whole of his investigation in the form of his cardiac out as well. So we go ahead with the 2D echo, and we see that the heart is quite good compared to the age. So the patient doesn't have any major issues at present, and he is on his normal life.
Right. Thank you, Doctor, for your insights. The case was managed extremely well with tremendous efficiency and expertise of Dr. Santosh and his team. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.